Thank you, Dr. Lullove, and welcome. I know that you have over 16 years experience as a podiatric surgeon. Tell us a little bit about your practice.
Evelyn, thank you for having me. I have a medical and surgical practice that's based on diabetic limb salvage, reconstructive wound care, reconstructive medicine, general foot and ankle surgery, and general foot and ankle surgical practice, as well as general podiatry practice. It's about a 60% Medicare, 40% commercial insurance split.
Wow. Give us an understanding. I know you've been using Endoform for a while, but let us know how you were first introduced to Endoform and how you use it.
Endoform was first introduced to me in 2012 when it was entered into the United States for use, and I've been using it ever since.
Dr. Lullove, how does Endoform fit into your wound bed prep regimen?
So I use Endoform as a first-line implementation collagen dressing for my patients. So when they present to the office with a new wound, they get a full thickness debridement with proper wound bed preparation, irrigation, cleansing, edge effect debridement, and they get their first application of Endoform Antimicrobial for the first 2 weeks. The patient then comes back to the office 3 days later to re-inspect the wound site and to reassess the Endoform Antimicrobial for signs of breakdown, how much is left, is it completely gone, is it still there? So that way I can make changes to the exudate management.
Excellent. Now you brought up a good point versus stating Endoform there or not there. Give us a little bit more understanding about when you do see Endoform present versus when you don't see. What does that mean to you as a clinician?
Because Endoform acts as a sacrificial substrate for metalloprotease activity, when we see Endoform completely destroyed in the wound bed at the next dressing change, I know that the capacity of the dressing itself has not overcome the amount of exudate in the wound that has MMPs. So that tells me to dose the Endoform collagen dressing either double or triple from my previous use.
Dr. Lullove, elaborate with us on how Endoform is utilized to manage that inflammation phase.
I'd be happy to. So when a patient comes in and we start in care, now that Endoform Antimicrobial is on the market, I'm now instituting the first 2 weeks of use Endoform Antimicrobial on a 3 times a weekly basis. So what that allows me to do is to help manage the inflammatory mediators within the wound, reduce the cytokines, and get better control of the wound environment. At about 2 weeks, which is about the average time we see inflammatory control, then I can switch to the natural Endoform and continue the 3 times a week for the next 4 weeks. Part of the treatment protocol is to see the patient a minimum of twice a week for the first 4 weeks to control the inflammation in the wound bed.
Dr. Lullove, thank you so much for your pearls of wisdom and giving us more insight into your successful clinical practice.
Thank you so much for having me.
I am Evelyn Hicks, Director of Clinical Education with Appulse Med. For more information about Endoform, please visit us at www.appulsemed.com. Thank you.